So for everybody listening, whether it's a hip, knee, breast, dental, neurologic, spinal, or any kind of implant, when it's placed, there are processes and systems in the operating rooms to avoid contamination of an implant. So it's very rare that one would get contaminated on placement for everybody listening. This is more in my mind. Over time, we get exposed to different things. And I'm sure on your show, as well as my show, we talk about the different exposures we can get through the environment and through products we use. But in this specific instance, we're talking about how someone, say, gets a cut on their skin and it gets inflamed or infected, and that bacteria from the cut enters our bloodstream. And because it's an implant, whether it's hip, knee, breast, dental, like I said, it can become attached to the implant because the implant's not your tissue. It doesn't have a blood supply. So why does that matter? Well, your body can't clear that. We recently published a paper that shows Cutibacterium acnes and then staph in our series are relatively the two most common things we find on those specimens when we take them out and send them off for testing. We use PCR testing. So we published that to establish a rate so that people understand what we're seeing in explants. So 29% of the time we find this bacterial contamination. And so I'm going to take it a step further so everybody understands how this works now. I used to hypothesize that because you had a contaminant of bacterial biofilm, that you would have immune system stimulation or activation that could give you symptoms. Well, we now know that's the case. So your immune system does get activated because the bacterial contamination interacts with a fatty acid in the breast tissue called oleic acid. That oleic acid will oxidize. Everybody probably who listens to your program and mine understands that oxidative stress or oxidation is not what we want. We want less of that because that builds up in our system and that's harder for our bodies to clear depending on how we detoxify things. And so it creates something called oxylipin 10-ho. And that oxylipin leads to more symptoms that are associated with breast implant illness, like fatigue, like anxiety, like muscle and joint pains. So those are all things that I used to just hypothesize were happening, but now they've been shown that that's truly the case in patients with large amount of symptoms of breast implant illness. It was published this past year, and the scientist is Dr. Mithun Sina. I've had him on my show and interviewed him. He's done just amazing work in this field.